Hypoglycemia is low blood sugar. Typically it is less than 70 milligrams per deciliter of blood sugar, which is seen in diabetes patients. Severe low blood sugar is known as severe hypoglycemia, which is typically less than 40 milligrams per deciliter. Severe hypoglycemia requires assistance with other people, while mild hypoglycemia can be taken care by the patient themselves. If you have hypoglycemia, symptoms are mild to begin with, but they can get worse very fast, and they should be taken seriously rapidly. To take care of hypoglycemia, you need to follow the rule of 15. You need to check your blood sugars every 15 minutes till it gets better. To do that, you have to take 15 grams of glucose every 15 minutes so that you can correct your low blood sugar symptoms or the number. You have to get to a goal blood sugar of 70 milligrams per deciliter at least, or till your symptoms get better. To get 15 grams of glucose, you can either drink a cup of milk, half a cup of juice, either orange or apple, or you can take about 4 glucose tablets. In the market, you can also get something called glucose gels. In patients who have type 1 diabetes, there is also something called glucagon, which is a shot which typically an EMS would give you if you are incapacitated or have severe hypoglycemia, and the patients can take it themselves, especially if they think if they're going to go into a severe hypoglycemia reaction. Hypoglycemia is part and parcel of diabetes management. To get to a good control of diabetes, one patient may at any given time encounter hypoglycemia. While we emphasize and we try that the amount of hypoglycemia, the frequency of hypoglycemia is minimal or none, it is possible for the patient to get hypoglycemic at any given time. The patient has to be given education regarding the symptoms so they are aware that they are getting a hypoglycemic attack. They need to have a meter, a glucose meter, so they can carry it with them as well. If they are aware that these symptoms are suggestive of hypoglycemia, they can take those preemptive actions so they can abort a severe hypoglycemia reaction to come from. Medication education is also important for these patients. Some medications are high risk of causing low blood sugars and hypoglycemic attacks. For example, sulfonylureas and insulin itself, as compared to others which are rather safe. And therefore, if they are on high-risk medications, they should be more cautious and carry the glucose meters and glucose tablets or juice or so on and so forth with them to be used in an emergent situation itself. The next important thing for these patients is the diet. These patients should have consistent meals. They should have separation of these meals by no more than a few hours. And they should have a small snack at night time as well. The snack is not important and mandatory in many patients, but it should have a little bit of carbs, especially if they're taking a high dose of insulin at night time. These patients should not go without meals for prolonged hours without physician knowledge. So for example, if they're going for any procedures, then medications might need to be adjusted, and they should inform their physician and adjust their medications accordingly. Lastly, patient information is very important again. So all these patients, when they come for their office visits, should be given handouts for informing them of what hypoglycemic symptoms are, what the signs are, what can be done to take care of hypoglycemia, when should help be called, and when does the medication adjustment is necessary, especially if the patients are experiencing many hypoglycemic episodes. Finally, some hypoglycemias will always happen. Just because a hypoglycemic episode happened does not mean the diabetes management needs to change completely for these patients. We need to learn from these episodes. We need to minimize them. We need to avoid them if possible, but we need to adapt to them as well.